Brain surgery recovery day 17. Today I was discharged as an oncology patient. I had my follow-up appointment with my neuro-oncologist. I was supposed to be in person, but where we live so far away from Boston and I already traveled there one day this week, they were flexible and let me stay at home. I had to beg, barter, and steal on that one. However, I do have to go in person the next time, which is a-okay with me. As soon as the pathology report came in, I was able to access it and read it through my patient portal. I do not speak doctor, so I took a screenshot of it and gave it to ChatGPT, and they gave me the lowdown. I knew we had good news on our hands, but having it come from the person that I genuinely trusted the most at this facility, it was surreal. The joy on their face when telling me the pathology and really giving us the nitty-gritty details on what it meant, being reassured that it's a very, very, very low chance of it growing back given the type of tumor it was, the praise my surgical team was getting on such clean margins, and the validation that I was healing so well. There was some concern earlier this week that I might be having seizure activity again, but that was ruled out today, which was also a huge success. I don't know if you can tell, but I'm grinning ear to ear with this information. Where my tumor was in my left occipital lobe, and they were obviously poking around in there to scoop it out, I'm just having eye adjustment issues. I'm going to see a neuro-ophthalmologist just to double check my vision, which needs to be done anyways, but they are convinced that I am not having seizure activity right now. And the cherry on this good news Sunday is that they are optimistic that we can get me off of one of my anti-seizure medicines with the plan of eventually getting me off of them completely. Again, an outcome I never even imagined was possible. I also got some movement in today for the first time and was so excited to use the stationary bike and walk.